Well, I'm the last one before the break and for lunchtime, so I hope you'll stay with me the last minutes or over the last minutes. I want to introduce myself. My name is Munk-Hartig. I'm a resident at the Department of Urology and Children's Urology at the University Hospital here in Kiel. And I want to talk about the biofeedback training, which we use in the therapy of children at our department. And especially I want to talk about the difficulties which we have. So what we use the biofeedback training for, especially in urology, we have to divide it into two parts. We can use biofeedback training for strengthening muscles, and we can use it in the therapy of relaxing muscles, and that's what I want to focus on during the next minutes. We can use it in voiding dysfunctions or defecation dysfunctions, and especially in voiding dysfunction, it's as it's called, detrusor sphincter discoordination. And I want to explain to you what this is and why we use the biofeedback training. So the normal way of voiding is that we have a filled up bladder and our pelvic floor is tightened so we don't lose urine. So when we then have the feeling that we have to go to the toilet, we sit down or stand at the toilet and we loosen up our pelvic floor, and then the urine starts flowing out and we have a big stream. And when we're done, our bladder is empty. So what patients have, and especially some children, which we treat in our department, is DSD, a detrusor sphincter discoordination. We have a filled up bladder. The children want to go to the toilet, and what they do is that the pelvic floor is like opening up and closing, and it's like it's going back and forth, like opening, closing. So the urinary stream is like always interrupted, and it's the bladder, which is a muscle, has to press real hard to get the urine out. And when these children think that they are done, usually they have a residual urine, so they have some urine left in their bladder. And what these children then say, they have to go to the toilet real often, because when I have something left, I only have some volume which I can fill up, so I have to go like not after 2 or 3 hours, but maybe after 1 hour again. And the consequences out of this disorder is we have a residual urine. We have, in this residual urine, if we get some bacteria into it, they feel really comfortable. It's warm, and they start to grow, and we get an infection. And that's how these children come, because of repeated bladder infections. Because of the stop in the urinary outflow, the bladder muscle is like doing bodybuilding. It's becoming a real thick bladder muscle, and this is what we don't want. And we have an increased pressure in the bladder, and the consequence out of that is that we get a urinary backflow to the kidney. And this is the worst thing that might happen, because that might lead to a damage in the kidney, and we know the consequences out of that. So what these children get is a therapy of biofeedback training, and this is one of the medical devices which we use. It's from Heimel Electronic, and it's called a MICTI or a MICTI Flow. And the goals of this therapy is that the children learn how to feel and how to control the pelvic floor. And what our goal is that they learn how to relax it, not tightening but relaxing the pelvic floor, and so that they get a normal urinary stream, and that we have a reduction in the residual urine. So the principle of the training device is that we measure the muscle potential by electrodes. The children are taught to put little electrodes on the pelvic floor, and so the training device might measure that this child actually learns how to relax and how to tighten it. This training device recommends certain requirements of the patient. The patient has to have a certain age. We cannot do that with a child that's like 4 years old. They don't understand the problem. They're too young. So we have to select the patients, and and the patient has to be willing to do this therapy. It's always a problem which we have when we have the patient, the 5 or 6 year old girl sitting there with their mother or father, and we explain what the disorder is, and the child sitting there looking out of the window or not listening, and then we talk to the parents, but the parents are not the ones who have to do this, so first the child has to understand what the disorder is, and then we can start with the therapy. And this is one of the main problems. So they have to understand the problem, and they have to understand the training device, and then we can start. Those are the different graphics which we have at the training device, and what these children then do is like the fish or the plane is flying, and then they have to relax the pelvic floor, and then the fish is going down, or the plane is going down, and then they tighten it, and it's going up again, or the flower closes up and opens and closes, and then the child knows what to do. And what we then do is the training devices always they measure it, because so we as doctors can control it afterwards. They get that training device at home, and they do it like every day for about 15 minutes. They practice and then come back and we do a control. This is a typical picture of a patient with a DSD. What we can see in the upper part of the picture is the urinary flow, and you can see it's going up and down, going up and down. And on the lower part, you see the EMG, the muscle potential, and you see that's always going up and down as well. This is that was at the beginning of biofeedback training, and at the end you can see that we have a relaxed pelvic floor, and that we have a continuous urinary flow, and that's our goal. So to achieve these goals, we always have to manage certain problems, and one is a loss of motivation. You tell the child to practice like every day they have to sit there for 50 minutes, and well, like after a couple of weeks, you see the child coming into our department with a face, and I don't want to do this anymore. So this is one of the major problems. The other one I've already mentioned is a selection of patients which is necessary, and we have a certain amount of patients who come back with a relapse of symptoms. So we have a certain goal. We want to improve this kind of therapy. We want it to be motivating the whole time. We want a long-lasting success, and it has to be easy in use, and it has to be child-friendly. So what we thought of, our new ideas, is that we wanted to be a game, like in certain levels, which the patient has to go through, that they have to, or that they are earning points by relaxing the pelvic floor, because that's our goal. And each level is with certain new tasks which the patient has to go through. And that's maybe place a new background area, so that the children have new input, and it's not getting boring. And each level is getting a bit more difficult by longer phases of relaxing the pelvic floor. So this is my own creation. What we thought of, our idea was that we take a little horse, and this little horse might walk through the landscape, and during this walk through the landscape, the patient is relaxing the pelvic floor, and then the horse has like certain tasks, like jumping over a fence, or go swimming through a river, or something like that. And during that time, the patient tightens the pelvic floor and then relaxes again. And then the child or earns certain points by the level of which they can hold the relaxation. And at the end of each level, the horse gains something, like maybe an apple to eat, or during the levels, maybe it's getting a bridle or a saddle. And with that, the horse goes into the next level, so that at the end maybe we have a little, for the girls, maybe a little princess riding on the horse, or a cowboy or something, so that we always have something new, and it's more motivating. point. So how do we want to achieve this goal? Where we have the Health Games project, it's the last one. We have Heinel Electronic who supports us with the technical devices so that we have the EMG electronic and well, Department of Urology with the medical knowledge and yeah, that's it. That was the first question already.
Yes, when I saw the horse, I thought that's very motivating for little girls.
Yes,
Perhaps think about the male version, like a little car called Lightning McQueen, and this might be quite successful for
yes.
boys.
Yes, thank you. True. Other questions?
I just want to comment on your comment actually. The idea of something different for boy or girl. I think what you develop is quite interesting because it obviously motivates, people to do exercise and so forth. And I think a bit of personalization because some people might have different motivations based on the journal and so forth. It could be something. So maybe something you might want to talk about with Sandro since he's working on personalization. Okay, more questions? Yeah.
I guess this presentation shows for me very clearly that the challenge is to bring the two disciplines together. Yeah, that is the view like a doctor has it, and the view like someone who is developing a game. Yeah, and I guess that's collaboration is necessary, and deeper understanding of each other. Yeah, that is for me an outcome of your presentation. Absolutely. So if we just talk about games, forget games. Yeah, I mean, health games you need to understand what really the issues are in means of health. Yeah, and have a deeper understanding of that.
I think it's funny, I did so many horse games. Some of them, especially for girls, entered top 10 in the German kids market, so I never thought maybe it's perfect for compliance issues. So maybe we can have to talk about it.
Yeah, from a game design perspective, I think you should be. I like your approach very much. So it's like a different kind of control. It's a kind of the input into the system, the control, and you want that they tend to do a specific movement of the control. But I think from the game design perspective, the level thing is good. But it should be not the same thing again and again and again. It's like a custom, a different custom, so it would be increasing long-term rotation in my point of view. But
yes,
I agree. It's a good way to have different challenges. The difference is a key issue.
okay. Thank you.
Felix?
Generally, when patients come to you, do you find it easy to get them to play the game for the first time, or is it a challenge to get them in there?
I think if you have good talk in the beginning and good contact, they will easily start with it, but the problem is actually the motivation for over the time, because we see the patients like every 6 weeks, and so then you will understand the loss of motivation after a certain amount of time. At the beginning, it's always, most of the time, it's a good start that we have. That's not a problem.
Okay, one more question? Yes?
Could this approach also be applied to similar problems like uncontrolled muscle contractions, things like that? Did you try? Or did you think about that?
Well, maybe I'm not the specialist in that that part, but I think that why not?
That's it. Okay, so thank you.